is Rose Vanderband, and I'm a medical assistant in training. And right now I'm going to show you a brief video about ear hygiene and ear irrigation. Now, most of the time, people don't have a problem with their ears, but they can get things caught in their ears, such as dirt, or maybe the substance for wax. It can get hard and crusty on some people, and it just doesn't wash out usually when you shampoo your hair, because usually the wax is soft. Now, just to tell you a little bit about the earwax, the ear naturally secretes a soft substance called cerumen, and the outer ear makes the substance, and it can build up without notice. You may not know that it's backed up. It has a job, and the job for cerumen is to protect the ear canal. So that way we don't spend all day scratching our ears, so it kind of moisturizes, and it fights off infection and bacteria. And dirt and pollen from the environment are also kept out of the ear by the cerumen. And next, why is earwax removal needed? Under normal circumstances, like I have mentioned briefly, when you wash your hair, that is definitely enough to get rid of the excess earwax. And as I mentioned, the earwax can build up in your ear, and it will be within the canal. And you can also have a hardened object in your ear, like sometimes small children will put rocks in their ears, or pebbles, little things like that. But they also have found in some cases where children have put like a pea or a piece of corn in their ear. Anyway, to get back onto why, another reason why you would need to have this done, this procedure done, is cerumenosis, which that's when the earwax gets impacted in the ear, and it makes it hard for people to hear. And the items you would need to perform this procedure would be your physician's order, your patient record, an emesis or ear basin, and this right here is your emesis basin. You'll need a waterproof barrier, which usually we have the drapes in the rooms for the waterproof barrier. An otoscope, which that's this right here. Now, just for the purposes of this video, I do not have this equipment here, but we're going to improvise just so I can show you how to do this procedure. And you'll want your irrigating solution, and what they usually use for that is warm water. But I have heard on other occasions doctors or people that will do this for themselves, they can use hydrogen peroxide. And basically, there's a few steps. First of all, you would come into the room and greet your patient. And right now I'm going to have my patient come into the room here, so I can show you a little bit about how we would do this procedure. And first of all, like I said, you come in the room, you'll wash your hands, you'll assemble your supplies or equipment. And for my purposes, I do not have the right equipment, but I'm just here to show you. Basically, what you'll do is you'll take a look at the patient's ear, just to check, and you'll use your otoscope for that. So when you do that, that's a little scope, and it's got a light bulb in it, so that way you can see into the ear canal to see what's impacted in there. And you'll position your patient comfortably, so go ahead and sit back, hon. And you'll view the ear with the otoscope, as I mentioned. And for an adult, you'll gently pull the ear up and just take a look. And for children, you'll pull the ear slightly down. So like for a small child, just because their ear is arranged a little differently, it's not as mature, you'll pull it down to get the solution through the ear. Now, first of all, we're going to set Jasmine up here with her waterproof barrier, which I'm using a towel, but normally you would have a drape in the physician's office. I'm going to have you tilt your head towards the affected side that is bothering you. First of all, we'll take the basin and hold it under the ear. So we'll hold it under this ear. If you can hold that for me, please. And then you'll have your warm, usually they use warm water to do this procedure, but not always. And I'm not going to pull the water into it just because I don't want to do anything wrong. But you'll pull the water into your syringe. So we'll pretend we've got water in here. and you'll bring it up to her ear. And like I said, for an adult, you'll pull the ear back a little bit, and then you'll slowly, you definitely don't want to go too fast, you'll slowly drain the solution into her ear. And as she does this, as I do this, I should say, the water will slowly drain back out and into the basin. Some of the things that you would need, of course, when you first walk in the room, you'll need the patient record and to know that the physician has ordered this. And after we're done doing that, we will put some gauze in her ear just to dry it out a little bit and have her lean her head towards that side to drain any excess water. And let's see here. I just went over all this. So you, like with this procedure, you'll want to continue irrigating the ear until you've removed the cerumen or the object. And if the patient has any complaints about dizziness or pain, you want to stop the procedure and get the doctor into the room to take a look. And like I said, do not use a lot of force when you're putting the fluid in the patient's ear. And then I have a slide here about contraindications. It's not advised to perform this procedure if the foreign body is something that can absorb water and expand. Some of these items would include the pea, the bean, or a corn kernel. And also if the child has a fever or cold or ear infection or an injury nearby their ear, because that could be something that would affect, you know, how it would, what's the word? that would mess with your results. So that's it, and that's all I have for that. And these here are the sources that I used. For the emesis basin picture, I used W.W. McDuff Medical. Otoscope was through Granger.com. Allegro Medical for the ear syringe. The superhero picture was ImagineAndVision.com. And for some of the advice that I found, I used NursesLabs.com and ConnecticutChildren's.org. Thank you for watching my video.